And I noted Maureen's observation that lab workers are to be celebrated and embraced in significant measure because, using your words, they put their lives at risk. And they do in the presence of various substances and pathogens, and it's an occupational vehicle. It's an occupational part of public health which has never received the regard and admiration it should have. And all of you work under difficult conditions, and sometimes those conditions can indeed be dangerous. I was looking at that recent Asia-Pacific study and noting that even in a part of the world where there's a great deal of sophisticated laboratory capacity, that fully a third of the laboratory hoods, the bio hoods, were insufficient, were in need of repair, and the efforts at biocontainment were therefore significantly undermined. So with all of that in mind, I want to somehow move biosafety into the center of priorities. There's no recognition broadly of the vital value of the work that is done by people in the realm of laboratories. I mean, it is one of the astonishing things internationally that laboratory work is taken for granted or depreciated when in fact it lies at the heart of all that is best in preserving the human condition. How in heaven's name do you do global public health without having biosafety, without having biosecurity, without having people who invest their lives in the laboratory realm? There's unimaginable pressure on people, that I recognize. I've been in many a lab where people were clamoring for CD4 counts, clamoring for viral load statements, and there was the laboratory worker under siege without much compassion or support. And it seems to me that biosafety, laboratory workers, should be thrust into the heart of that. See, none of it happens unless you do your jobs securely and with safety. We don't get the results we need, we don't get the momentum we need, we don't get the answers we need unless they emerge from the laboratory confines. I don't know why people don't understand that, but obviously it's true, whether it's Chaga disease or whether it's HIV, malaria, tuberculosis, or dengue fever. It doesn't matter what you're dealing with. You have to have your laboratories together and functioning in a safe way. So I want to suggest strongly to you that one of the things you should be saying in the advocacy measures is that the pandemic of HIV and AIDS, which still has 34 million people in its grip, 23 million of them on the African continent, and the world wants to get rid of it. And they now have this compendium of prevention measures. And I feel strongly that the biosafety associations, both national and international, should be making of their role a kind of cause célèbre and tie it directly to an AIDS-free generation. Use the language which is being used. Say to them, you're not going to have an AIDS-free generation without biosafety. You're not going to have it without the finest laboratories in the world. And I would go one step further. Everybody in this room knows about the Millennium Development Goals. Everybody knows that the 8 goals are going to end ostensibly in 2015. So it's important then to look at these Millennium Development Goals and think, well, where does biosafety fit in? And frankly, if I were you, I would be submitting a brief to David Cameron, the Prime Minister of the United Kingdom, who is in charge now of the next set of goals, which will follow from 2015 on, probably the next 10 years to 2025. And what about putting the targets and the objectives of biosafety and biosecurity into the new set of Millennium Development Goals? Why not make it, I mean, this is an organization which is beginning to flourish. You've got 47 countries here, for heaven's sakes. You have some weight in terms of what you say. You have some clout. You have access to significant people. Why not say to David Cameron, put it on his radar, when you are enunciating the goals that will be achieved by 2025 and the next set to be affirmed by the countries of the world in the General Assembly of the United Nations in 2015, what are the goals for biosafety? What should we have in all of the laboratories? What kind of funding do we need? What are the targets? If I understand the material, and I won't presume on you unduly, along with biosafety comes biosecurity, and that's much more difficult and sensitive to reconnoiter because it's situated in the realm of menace and apprehension. It's been so much more worrisome since 9/11. It's been so much more worrisome since the anthrax scare, of course, and people feeling that chemical agents could be used. Fissionable materials could be taken. There's theft, there's malice. What happens if such and such falls into the hands of so-and-so? And again, it seems to me legitimate that this should be translated into a new regard for biosecurity. I mean, the dependence of the world on your integrity and your excellence and your reliability in the realm of biosecurity is obvious. So again, I think you have to make the case, and I would make the case that thefts won't occur and pathogens won't be distributed recklessly, and fissionable materials won't be stolen by terrorists, and the people who man the laboratories and the facilities are all reliable. And I would elevate it again to a level which governments would understand is imperative. But it is, I think, important that your voice be heard, that you make statements, that you deliver important messages, that you reach the Security Council, the G8, the G20. You have some champions who make biosafety and biosecurity the kind of obsession of their public statements. That you make people understand that the major diseases in the world cannot be handled without the presence of everyone in this room and all of your colleagues who are not here. It would be an important breakthrough. And if you identify it and attach it, as I said, to an issue whose time has come, then the public will listen to you. Thank you for having me.